You're listening to Finn Voices on Healthcare Now Radio, where we highlight and amplify the voices at the forefront of health innovation that improves people's lives. Join us for an inside look at the change makers driving conversation and answering the most important questions in healthcare today. Thanks for joining us.
Hello, everyone, and thank you for tuning in. I'm your host, Beth Friedman, Senior Partner at Finn Partners, and I'm based in Atlanta, Georgia. And my guest today is Mayur Yermaneni. Mayur is Executive Vice President of Strategy, Innovation, and Growth for AssureCare. They're a leading pop health and care management technology company. Mayur, you have 20 plus years of health IT experience, and I know your experience spans payer, provider, and medical devices. Unique perspective for sure on pop health and analytics and medical management and how innovation will advance these areas. And that's, I think, what I really want to talk about with you today is what are we seeing in the year to come? So, Mayur, welcome to the show.
Thank you, Beth. It's a pleasure and an honor to be on the show.
Super. So let's set the stage a little bit for our listeners. Your background is unique. You've got both payer, provider, and of course the medical device experience. What I'd like to talk about is the three things that I see as sort of, areas for technology innovation of focus, if you will, in 23. Value-based care, the evolution of the pharmacy and the role of pharmacy, and then sort of those smart devices that we've got scattered around our homes, right? How are those going to play more of a role in our healthcare ecosystem? So let's start with value-based care. We've been talking it for about 2 decades. Greg and I were just talking about how the old HMOs and managed care from about 2 decades ago. I think we were targeting 50% of reimbursement through VBC by 2020. I know we're not there yet, but I do know we're making progress. I did find that survey last week, I think it said 69% of providers now participate in some type of alternative payment model. So I'm just really curious, since you've been on both sides of this equation, where do you see value-based care headed in 23? What are your predictions there?
Great question, Beth. I think value-based care is going to take a lot of prominence in 2023. And there's a couple of reasons for it. And I think everybody is tired of hearing of healthcare costs rising quite a bit and wanting to manage the risk. But more than that, I think payers and providers are much more organized now than they were before. And they have a lot more insights into how to look at the membership that they're serving to and how to organize themselves to make that happen. And they're now at a point where they're willing to take a risk and they're wanting to improve the outcomes while minimizing the cost. So I feel we're at a juncture where there's going to be a lot more prevalence to it. Now, is it going to get to that 50% or maybe more? I don't know. But I feel that 2023 and 2024 is probably where we're going to see a lot more penetration of VBC in the marketplace.
I sure hope so, right? I think it'll be a positive for both the consumers, the payers, and the providers. I mean, really all the stakeholders in healthcare. So let's kind of focus in or hone in a little bit on some of those specific stakeholders. So let's start with payers. Anything specific that's pushing those payers to take on more risks, to do more with value-based care in 23 and 24?
A couple of things are happening. I think the payers are having an increased pressure on them because of the rising cost and their spend going up a lot. And another aspect of it is, which is a lot more delicate, is their own customers, whether it's the individual member or the self-insured market or the Medicare or Medicaid, are much more aware of the cost burden it is on their financials. So, and they're much more engaged. I mean, what you used to see about a decade ago or so, where the healthcare decisions were being done by the HR administrators. Now you see the CEOs and the CFOs being involved in it. And they're asking the questions, okay, what are you doing with my membership? What outcomes? How are you improving the outcomes? So that's one of the key aspects of it, including in Medicare and Medicaid. And we all keep hearing the drug spend is going up, especially pharmacy spend is going up. Well, there's only so much you can do, especially from that side of the equation. There's a lot you can do on that side, but there's a lot that hasn't been done. But we have continuously tried to spend money on chronic condition management, and yet we haven't seen any drastic improvement. So why is that? So they're also trying to make a difference on how can I contain that cost, because now I have that to contend with, and then I also have the drug spend to contend with. So how do I actually reduce that cost structure? So they're trying to figure out how do I create a alternative payment structure or a risk-based contract or a value-based care contract so that their providers that they're working with can improve the outcomes at a lower cost structure. So I would say that probably is one of the those are the major reasons for BPC taking a prominence and payers wanting to take a much more risk on it.
Do you, in doing that, do you think the payers are going to really try and focus a bit more on improving the relationship with the provider? Because I know it's always been friction, right? All these years between those two stakeholders. So do you see them maybe more a little bit open to having better communication, better conversations, better collaboration with the providers?
Absolutely. And you're already seeing that in the market. I think where there was a clear demarcation between payers and providers, now that line is blurring because the payers, you're seeing some of the payers actually acquiring the provider side of the equation and some of the providers turning into a risk-bearing entity by wanting to be a payer side of the equation. So you're seeing that line being blurred. And in addition, the payers want the providers to be successful because the risk is with the institution. So if the providers become successful, they inherently become successful. I mean, you can see this in the attitude change where they're now willing to share the data with the providers. Hey, this is your membership. This is what's been happening with you. Can you address these care gaps? Where they're actually doing some of that insights work for the providers so the providers can act on it. So I definitely see that kind of integration happening a lot more. And then it's not just about data sharing. They're willing to not only share their data, but they're also asking the providers to share the data from the EHR so they can do a much more analysis on the risk profile and see how else can they be compliant, helping the providers become more compliant on it. So I think it's a matter of time when providers and payers, as we know, might not be the same in the next few years. It will become one big risk-bearing entity, organizations who are willing to take a risk on a subset of population. They could be payers, providers. So that might be the paradigm shift.
Yeah, it might shift, right? And from what you just said, Mayur, it sounds to me like that data exchange, that data sharing, the better interoperability, that all might be an elixir to sort of help these two be both more effective in reducing costs and taking risk collaboratively, right? Doing it together.
Correct. Because it's in both of their best interest to figure out how to make that work collectively. Because if one loses, the other loses. And we're forgetting the most important perspective as well, the patient perspective. Because even in today's age, patient is much more health literate. And that's not in terms of the conditions that they have, but it's also in terms of the payment operations. How is the payment of a healthcare system works? How do I access care? They're much more literate and they're willing to shop around. Not everybody, but that sentiment is actually increasing quite a bit. So even from that perspective, you want all the entities coming together and working together to improve the outcomes at all the levels.
Yeah, I see that. I see that in my own patient care experience, and not just asking providers for more transparency, but now also asking the payer for more transparency, right?
Right. We're all tired of that EOBs coming through and figuring out, okay, well, can I just pay this? So how do I make sure that this not the same bill going to happen again?
So let's shift now. The second area that you and I had chatted about was this evolution of pharmacists and their role in the healthcare ecosystem. So I realized that there were some changes in reimbursement during the pandemic, perhaps a silver lining for pharmacists where they're now getting reimbursed to actually become more of a care provider. I don't know the details, you probably do, but tell us your predictions for pharmacy and the evolution and role there.
Yeah, so if you look at the market today, there are a few things that are happening. So there's industry drivers like healthcare shortages. I mean, we've been hearing about healthcare work shortages even before the pandemic. And with pandemic, what happened is that got exacerbated because now you add burnout to that. And then on top of it, you're looking at a lot more consumption. So as a result, what used to be a shortage, now that's a dearth. So any welcome change in seeing how even additionally qualified providers can become. So pharmacists happen to be very qualified from that perspective. And if they become certified as providers, then it'll help alleviate to a certain degree. I wouldn't say that it's going to completely solve the problem, but it's going to definitely alleviate the healthcare staff shortage. And they are especially in the rural communities where they are truly as a confidant for some of these members, they can really tremendously add value. So I think there was a bill introduced, there was a bill introduced last year to certify the pharmacist as the providers, especially in the medically underserved areas. When that happens, I fully anticipate the dynamic of how a patient is being cared for in some of these communities completely different. And that's actually a welcome change for everyone, because that means that I can go to a retail pharmacy or a community pharmacy and get a lot more than get my prescriptions filled. I mean, you can see one of our client, Kroger, doing that quite a bit. And then other entities are also doing similar kind of scenarios. So I think getting the certification is going to eliminate the payment parity side of the equation, and then it'll help them to be much more innovative as well. And we all can use that innovation and how do you address the capacity shortages to drive a better outcome. So it's a critical juncture. I'm looking forward to that change and helping our clients and anybody who's willing to take that chance to say, how do we get better at it?
Yeah, you mentioned Kroger is one of your clients in the pharmacy space. And I know that they're using your technology. There's obviously some things you can share there. Give our listeners just a few like sort of must-haves that you see pharmacies needing from a technological perspective in the year ahead. I know that there's going to be much more of a focus on care coordination and, obviously the communication back and forth with the providers. Just share a couple technology innovations and capabilities that are going to be on that checklist.
So if you think about the care management space and population health space, that has been a lot being prevalent in the payer space and the provider space. But the pharmacies also need the similar type of technology, because it's one of the entry point for a patient or a member when they walk into a pharmacy to get the prescription filled. If they have a technology to not only take that entry point and say what else is happening with that member, what care gaps can I help with, what vaccinations or medication reviews or medication therapy that it can do, that insights that they can glean off of on a member outside of their current system, outside of their current dispensing system, this technology for them to do this and then actually follow through with actually member management in that setting and then connecting with the clinics. That technology integration is going to be very crucial and very helpful for the pharmacist in the capacity of the provider being much more engaged and enabling the outcomes of a member. So I think that's one of the key technologies. In that discussion, there's elements of analytics, there's an element of workflow and actual member management, and there is a documentation to it. All of this outside of their dispensing systems, which in themselves are technology advances, but here also, if they couple this, then we can add a lot more value into it.
Got it. So looking for probably some technology expansion in the pharmacy area to achieve that care coordination and the and from a payer perspective, the member management, right?
Correct. So I think you might have heard the medication therapy management, med adherence. These are the elements that can be done in these technologies, but not just that, but also looking at what else can they be doing? What care gaps can they be doing? What medication polypharmacy issues can they be addressing? And how do I work with the member to get them engaged more in their health? Because this is another touch point that you can take advantage of from the membership standpoint. And you have a captive audience. When they walked into the pharmacy, they're getting for their health needs. So you have their attention, even if it's for a short span. Can you take that short span of advantage and get more outcomes out of it? So that's where the value is. So how efficient are you in that short period of time? Technology is going to dictate that. And technology with the information it needs is going to enable that a lot more. And we're spending quite a bit of energy in doing all of that stuff.
Sounds awesome. So if you're just tuning in, I'm Beth Friedman, and you're listening to Fin Voices on Healthcare Now Radio. I'm talking with Mayur Yermaneni about 2023 health IT innovations. We've chatted about value-based care and pharmacy. I don't want to leave the topic of pharmacy, though, without asking one question. I'm just curious about it. Every day it seems I see another large retail pharmacy chain snapping up a medical practice, a primary care clinic, or something like that. Is that a trend you see continuing in the year ahead?
Absolutely. I see that for two reasons. One, expansion of the market, and two, because remember I talked earlier about the captive audience space where they walked into a pharmacy for a given health need. And while you have it, can I take that and transition into the clinic environment as well? And if that clinic is in the adjacency, can I take advantage of it? So that's why you see a lot of these pharmacies picking up the clinic side of the equation or ramping up their clinic operations. So it's a good thing for a member because now you can actually see is where I went in for one need, but if I can get more out of it, still a short span, but can I get more out of it? I see that going to only increase in the coming years. Now, that still has to work with the community and the outside health systems as well, but it's a trend that I foresee continuing to expand.
Cool. All right. So, last topic for the day I wanted to chat with you about is where do you see these smart devices? So, I have Alexa in my kitchen and I'm starting to rely on her for so many things. I know there's Google Home, there's just, a plethora of these, and they're becoming so commonplace. Where do you see us relying on them, if you will, for healthcare? What's their role going to be going forward?
One of my favorite topics because technology evolution is changing the way we think about every aspect of our life. I mean, take Apple, for example. I mean, if you think about how they have positioned themselves, they expect you to sleep with their watch, good or bad, because there are a lot of things that can happen. But similarly, doesn't have to be tethered. Some of these devices don't have to be tethered to your hand or to your body. I mean, to your point, you already have an Alexa. Can we do a lot more than that? Can Alexa add into the intelligence of, especially in a senior citizen home care setting, where can those devices be used to fall prevention or connecting with their PCP to the next appointment? Much like today, some of these ecosystems allow you to order supplies when you're out of it, just with the voice command. Can we do the same thing? I foresee that happening. Now, they all need to be done within the realm of guardrails for privacy and security concerns. But when that happens, now you're seamlessly integrating the existing devices in your ecosystem, in your home ecosystem to leverage your healthcare needs as well. So Alexa, Google Home, I'm not picking on any one of them. I think there are a lot of devices that can do that. It's how do we make that? Because the things that people are going to be worried about is, do I have to have yet another device, or can I leverage what I already have in my daily life and do that? So at that, it's an interesting prospect. I think Apple Watch, Alexa, Google, who knows what else is going to come up with, but it's about how do you connect them? How do you connect them seamlessly? And how do you take advantage of that to your next level without having to breach security or concerns on that side of the equation?
So, good point about that, really using the same device for more things, like to the Apple example, right? 10 years ago, 20 years ago, I never would have thought I would need a phone, not need a camera because it was in my phone, or not need a flashlight because it was in my phone. So, to your point, can we start maybe seeing help with scheduling appointments, right? The fall prevention. I love the fall prevention. My mother is 83 years old, and I worry about that with her, right? I worry about her falling at some point at home, because even now that's her excuse to not do yoga. I'll tell you the personal story. She won't do the yoga because she says she can't get up from the floor after she's on the floor on her yoga mat. So.
Yeah, I mean, we all have those kind of stories, right? Where we're caring for our elders and we have to address some of those things. And so if these things can enable, at least to a certain level, then it's a welcome change. Now, we have to be careful in how we deploy them too, because then you raise the privacy side of it. What else is happening when they're listening to all this stuff? So, we've all heard that paranoia as well, but there's a positive side to all this stuff too.
Yes, exactly. So let's talk about the back end of some of these home devices. And I may be asking you more questions than we have answers for right now. So we talked a little bit about looking forward innovation with these devices with an eye toward privacy and security. Very important. What about an eye toward getting that data back into the HR and back to the provider so that we can make the most of it. Is that also something you see on the horizon?
I do. I think technology is not the barrier there. I mean, those things can be done even today, but do we have the right guardrails in place where that exchange is being enabled? And are all the players on the same interoperability standards where I can do that effectively? And if I do that, is there a recipient in such a way that can they act on it immediately or within a reasonable time? I think that's where of a more of a business operation issue and change management issue that needs to happen from a technology standpoint. I think any device can send information to any other device to make that happen as long as there's a mutual handshake between it. But can you do this one at a time, or can you create a standard where that's possible? I think we're getting there slowly. I think the fire standards are going to help make that happen a lot more. So how well are those standards going to be adopted by everyone, and how aggressively is everybody going to pursue that? That's a great step towards it. I mean, we ourselves are looking at the fire standards in every single aspect of operation that we're doing. Can we increase that? Because we're anticipating that's going to happen. And how do we make sure that we are ready to enable our clients to better care for their value-based care models, and whether it's in the pharmacy space, specialty pharmacy, or payer space or provider space. So it's going to happen. I think it's just a matter of time.
Well, being haven't been in the industry a long time, I know you have as well. I do see in general, maybe it's just my optimism, but I do see much more interest in standardizing on those transaction standards and the technology so that we can get to the place I think we've all been searching for a while now. So it's kind of an exciting time to be in health IT for sure, and have really enjoyed having you on the show today, talking a bit about what's going to happen in 23 with value-based care, with pharmacy, the role of pharmacy, and then also these smart devices. Mayur, any final thoughts on technology innovation before we close out today's show?
It's an ever-changing landscape. I think if one thing I've learned is if we stop thinking about innovation, then we're also declining to participate in the next era. So I fully see innovation should be the DNA for every company that wants to continue to see the future.
So, Mayur, one of the things that we hear all companies in health IT doing these days is integrating AI, machine learning, RPA into their solutions. What's ahead for AssureCare when it comes to integrating those specific tools into your solution set?
Great topic. I'm very passionate about those areas as well. And at our company at AssureCare, we're investing quite a bit on that one too. But before we get into the discussion of what AI and ML and how it's solving the problem, I think at AssureCare, what we always look at is what are our client business operations? And when we are putting in technology to enable their outcomes, whether it's their value-based care methodologies or population health, what we're thinking about is how can our systems integrate more AI and machine learning based methodologies that will help them make a better decision or improve decision outcomes, or even enabling their decision. So we're spending in our business process, so how do we integrate those technologies into? So we have a couple of areas where in our medical management space and the care management space, where we're deploying those technologies to say, can this help our clients improve their outcomes? Can it alleviate their capacity concerns? So we're answering these questions, and our clients can benefit from those methodologies that we've been investing in on their behalf and improve their daily life, whether it's the decision making or whether it's the process. I think what the industry has been looking for is, we've been talking about big data and a lot of that stuff. In a few years time frame, I fully envision the big data discussion is probably going to be in the background, because the AI ML that's leveraging the big data is seamlessly integrated into the decision-making systems of our clients. So we're doing those things in our system so that it can be implemented in our client environment as well. So we're going to be spending a lot of our time, and we're already making some headways into how we change the technologies to make that happen.
Absolutely. Absolutely. Well, Mayur, thank you again so much for being on the show today. How can our listeners get in touch with you? I wanted to make sure we provided that before we close.
They can reach out to me through our company website or reaching out to my email, my first name at AssureCare.com. And I'm happy to respond to your listeners, their questions, or work with them in case they have any opportunity for us to collaborate. So I thoroughly enjoyed being on the show, and hopefully you'll invite me back.
You got it. Thank you so much. And that's a wrap for today's broadcast. We want to thank our listeners for tuning in. Until next time, in All in Health, this is Beth Friedman at Finn Partners.
Finn Voices is brought to you by Finn Partners, a global marketing and communications agency working across industries and services. Whether inside our walls or on the front lines of health transformation, we stand together to create meaningful and measurable impact on the world around us. Learn more at finnpartners.com and follow us on Twitter @FinnPartners.